Chronic Obstructive Pulmonary Disease, or COPD, is a serious lung condition. It affects millions of people worldwide. COPD makes it hard to breathe. It gets worse over time, but knowing the signs can help you get treatment early. COPD includes two main conditions, emphysema and chronic bronchitis. Both make breathing difficult. They damage your lungs. This damage can't be reversed, but early treatment can slow it down. The main cause of COPD is smoking, but non-smokers can get it too. Long-term exposure to air pollution or certain chemicals can also cause COPD. Some people have a genetic risk for it. Recognizing symptoms early is key to managing COPD effectively. In this essay, we'll look at the main symptoms of COPD. We'll explain them in simple terms. This information can help you spot potential problems. Remember, if you have these symptoms, see a doctor. Only a healthcare professional can diagnose COPD. A chronic cough is often the first sign of COPD. It's not just any cough. It's one that doesn't go away. It lasts for months or even years. This cough is different from a cold or flu cough. It doesn't get better with time or regular cough medicine. People with COPD cough a lot. They might cough more in the morning, or they might cough throughout the day. The cough often brings up mucus. This mucus is also called phlegm or sputum. It can be clear, white, yellow, or greenish. The cough happens because the airways are irritated. They produce more mucus than normal. This extra mucus is the body's way of trying to protect the lungs, but it makes breathing harder. It can also lead to infections. This persistent cough can be tiring. It can interrupt sleep. It might make people avoid social situations. Some people feel embarrassed about coughing all the time, but it's important to remember, a chronic cough is a sign that something's wrong. It shouldn't be ignored. Shortness of breath is a key symptom of COPD. At first, it might only happen during exercise. But as COPD gets worse, it can happen during simple activities. Things like walking upstairs or carrying groceries become hard. This shortness of breath is also called dyspnea. It feels like you can't get enough air. You might feel like you're breathing through a straw. Some people describe it as a tightness in their chest. Others say it feels like they're suffocating. The reason for this is simple. COPD damages the lungs. It makes the airways narrow and inflamed. The air sacs in the lungs lose their stretchiness. All of this makes it harder to breathe in and out. Your lungs have to work harder to get oxygen. As COPD progresses, shortness of breath can happen even at rest. This can be scary. It can limit what you can do. Many people with COPD avoid activities to prevent feeling out of breath. But staying active is important. It helps keep your lungs working as well as possible. Wheezing is another common symptom of COPD. It's a high-pitched whistling sound. You might hear it when you breathe. It's most noticeable when you breathe out, but it can happen when you breathe in too. This sound happens because the airways are narrow. Air has to squeeze through these tight spaces. It's like blowing through a small whistle. The smaller the space, the higher the pitch of the wheeze. Wheezing can come and go. It might be worse at night, or it could be worse in the morning. Cold air or exercise can make it worse. Sometimes you might feel the wheezing more than you hear it. It can feel like a rattling in your chest. Not everyone with COPD wheezes, and not all wheezing means you have COPD. But if you notice this sound often, tell your doctor. They can listen to your lungs and do tests. Section 5. Chest tightness. The uncomfortable squeeze. Chest tightness is a less-known symptom of COPD. People describe it in different ways. Some say it feels like a band around their chest. Others say it feels like something heavy is sitting on their chest. This tightness can be uncomfortable. It might make you feel anxious. Some people worry it's a heart problem. The feeling comes from the lungs working harder to breathe. The tightness happens because the airways are inflamed. If you feel this tightness often, talk to your doctor. Section 6. Frequent respiratory infections. A recurring concern. People with COPD often get more respiratory infections. These include colds, flu, and pneumonia. They happen more often and can be more severe. This is because COPD weakens the lungs' defenses against germs. These infections are a big problem for COPD patients. They can make COPD symptoms worse. A simple cold can turn into a serious illness. It can lead to hospitalization. That's why preventing infections is so important for people with COPD. The symptoms of these infections can be similar to regular COPD symptoms, but they're usually worse. You might have a fever. Your cough might produce more mucus. The mucus might change color. You might feel more short of breath than usual. Frequent infections can damage the lungs more. This makes COPD worse over time. It's a cycle that's hard to break. That's why COPD patients need to be careful. They should get flu shots every year. They should also get pneumonia vaccines. And they should wash their hands often to avoid germs. Section 7. Fatigue, when tiredness takes over. Fatigue is more than just feeling tired. It's a deep exhaustion that doesn't go away with rest. For people with COPD, fatigue is common. It can be one of the most frustrating symptoms. It affects daily life in big ways. There are many reasons for fatigue in COPD. The main one is lack of oxygen. When you can't breathe well, your body doesn't get enough oxygen. This makes you feel tired all the time. Your muscles don't work as well. Even simple tasks can feel exhausting. Another reason for fatigue is the extra work of breathing. People with COPD use more energy just to breathe. Their lungs have to work harder. This uses up energy that could be used for other activities. It's like running a marathon just by sitting still. Fatigue can lead to a cycle of inactivity. You feel tired, so you do less. But doing less can make your muscles weaker. This makes fatigue worse. It's important to stay as active as possible. Regular exercise, even if it's just short walks, can help fight fatigue. Section 8. Unintended weight loss, a late-stage symptom. Unintended weight loss is a symptom of advanced COPD. It doesn't happen to everyone, but when it does, it's a sign that the disease is getting worse. This weight loss can happen even if you're eating normally. There are a few reasons for this weight loss. One is that breathing takes a lot of energy. People with severe COPD burn more calories just breathing. It's like they're exercising all the time, even when resting. This uses up a lot of energy. Another reason is that eating can be hard. When you're short of breath, chewing and swallowing take effort. Some people feel full quickly, others are too tired to eat. This can lead to not getting enough calories. Over time, this causes weight loss. Weight loss in COPD is serious. It can make you weaker. This makes it harder to fight infections. It can also make breathing even more difficult. If you notice you're losing weight without trying, tell your doctor. They can help you find ways to maintain a healthy weight. Swelling in extremities, more than just puffy ankles. Swelling in the ankles, feet, or legs can happen in advanced COPD. This swelling is called edema. It's a sign that COPD is affecting your heart. Fluid builds up in your legs and feet. The swelling might be worse at the end of the day. It might go down when you elevate your legs. This symptom shows how COPD affects the whole body. If you notice swelling, tell your doctor. They might want to check your heart function. They might suggest elevating your feet or wearing compression stockings. Section 10. Cyanosis, when blue isn't a good color. Cyanosis is a serious symptom of advanced COPD. It's when your lips or fingernail beds turn blue or grayish. This happens because there's not enough oxygen in your blood. It's a sign that your body isn't getting the oxygen it needs. This bluish color can be scary to see. It means your oxygen levels are very low. Your body is struggling to get enough air. Cyanosis can happen suddenly during a COPD flare-up, or it can develop slowly over time as COPD gets worse. Cyanosis is more than just a color change. It's a warning sign. It means your organs aren't getting enough oxygen. This can lead to serious problems. Your brain, heart, and other organs need oxygen to work properly. Without it, they can be damaged. If you notice this bluish color, it's an emergency. You need medical help right away. Don't wait to see if it gets better. Call for emergency services or go to the hospital. Cyanosis means you need oxygen and medical treatment immediately. Section 11. Reduced exercise tolerance, the struggle to stay active. Reduced exercise tolerance is a common problem in COPD. It means you can't do as much physical activity as you used to. You might get out of breath quickly. Even light exercise might feel hard. This can make staying active a real challenge. This happens because your lungs can't keep up with your body's oxygen needs. When you exercise, your muscles need more oxygen. But COPD makes it hard for your lungs to provide this extra oxygen. You feel short of breath faster than normal. Reduced exercise tolerance can affect your daily life. Simple tasks like climbing stairs or carrying groceries become difficult. You might avoid activities you once enjoyed. This can lead to a less active lifestyle. Over time, this can make your overall health worse, but it's important to stay as active as possible. Regular exercise can actually help COPD symptoms. It strengthens your muscles and improves your breathing. Start slow and build up gradually. Talk to your doctor about safe ways to exercise. They can help you find activities that work for you.